Yeah, I'm Matt Carson. I'm the head of the Digital Systems Department at Northwestern and Industrial Sciences Library. Last January, we had the opportunity to join the MAP pilot. And in addition to testing their machine actionable features, we tried to learn more about our own institution's research data landscape and to build collaborations across our campuses. Next slide, please. Most of the team for this project is located in Gulter, which is part of the Feinberg Medical School. Next slide. So we're physically separated from the main campus up north in Evanston, and the university governance structure is such that Gulter reports to Feinberg, the Feinberg dean, while the Northwestern University Library, Central IT, and other units that we interact with report to the provost. In addition, some of these units serve the entire university, while others, like Gulter, provide services only to Feinberg. So we have different but overlapping user bases. And because of this, there are times when the priorities from our respective units don't overlap, but we've been making concerted efforts to align our goals, especially around supporting the NIH data management sharing policy and other RDM support. Next slide, please. The last several years, our department has managed a research support core for Feinberg that we call the Data Lab, which follows a primary care model for data-related consultation. After a researcher contacts us, we'll meet with them to discuss their issue and determine if it falls within our expertise, and if so, work with them to resolve it. And for issues outside of our expertise, we or specialized or long-term support, we refer them to our research services partners. Leading up to January 23, when the NIH data management sharing policy was coming into effect, we were asked by the dean to lead the effort to support this new policy, and we knew that was going to be a big lift. Feinberg provides about 70% of all research funding across Northwestern, and 62% of that funding comes from NIH. In fact, in 24, Feinberg was 13th in NIH funding among all medical schools, American medical schools. So providing this service was going to be a team effort, and those of us at Gulter have been trying to establish relationships with different institutional stakeholders and with units to build capacity for DMSP support and other RDM support since then. Over the past couple of years, many of our Indian partners have also been undergoing reorganization, bringing in new hires, and retraining existing staff to support RDM activities. Next slide, please. The MAP probably gave us an opportunity to continue moving in this direction and to engage and build trust with our campus partners around these services and to demonstrate the value of machine actionable DMSPs to partners in their workflows. It also allows us to create a more complete picture of the RDM services landscape at NU and to see if there were areas where to make improvement. And we also wanted to create the foundation for the future with integrations for research information management systems and possibly institutional repositories. Next slide, please. Some of our early efforts were focused on the basics. Like we were starting from where we just needed to coordinate our services. So we worked on creating collaborative and centralized RDM services across campuses. And thanks to our partners in research computing and data services, especially Till and Magley, we have a really nice website that links out to our various resources for RDM planning, data sharing, et cetera. We established a university-wide RDM consultation service that uses the IT ticketing system. And our Gulter team became co-administrators of Northwestern's DMP tool instance so that we could contribute to support for the tool, update documentation, and continue incorporating that tool in our guidance and our classes. And finally, we established regular meetings with data services groups, as well as a quarterly data sharing meeting with the administration of units in Feinberg, like the Dean's Office and Feinberg IT and sponsored research, so we could discuss issues and trends in researcher support. I'll talk a little bit more about some of these efforts in the next slides. Next slide, please. So research data at NU is a joint effort between Northwestern University Library, Research Computing Data Services, and Gulter. And it uses the IT Service Management Portal, which is a central location for different IT support services. It has a knowledge base with instructions on how to change your password, access listservs, that kind of thing. And there's also an agency list of services that can be searched, and each service has a description page with a link to a consultation request form. Researchers make a request either through the service page or by affiliated email, And then these requests are routed to through the ticketing system and distributed to the sport teams. Next slide, please. So our consultation workflow starts with a request from a researcher, which is routed to the service management portal and the ticketing system, which notifies all the participating members of the 3 partner units by email. And then those members review the requests. And if it's one of their topics, a member from that group takes responsibility by going into the ticketing system and assigning it to themselves. That person then responds to the request, and this email chain by default is sent to everyone as an FYI. If the requested topic is not in one of our groups, we can respond to the ticket and bring in additional service units by adding their emails to the chain. So IT helped us set up this workflow, and it's been working fairly well, but we still had a bunch of service request pathways, and some of them we were able to address by making them part of this, and one of that's the DMP tool. Next slide, please. So those of you who have used DMP tool probably seen this, but on the project pages, there's a tab that allows you to request feedback. Initially, in our instance of DMP tool, we had set this up, or someone had set this up to so that the request was routed to an email address monitored by a librarian at NUL. And we changed this to research data at Northwestern so that we could bring the DMP tool into the established communication channels and share the responsibility. So it wasn't just one person having to check this. And also we wanted to share the information with a larger team. So you can see on this page, the user is told that they will receive a response within 48 hours, and they can email the research data, if they have any other questions. Next slide, please. So now when a user requests support for a data management sharing plan through DMP tool, a message is sent to the service management portal, and it follows that existing workflow that I just talked about. Next slide, please. And we thought it made sense to also move our Galter Data Lab service into this workflow. So in this case, when a researcher requests Data Lab services, the notifications are only sent to Galter personnel. However, if we need to ask for support from other groups, we can request that as described before. So, the DMP tool, adding this DMP tool and adding Data Lab to the service management portal is pretty low hanging fruit, but it was something that we could do that really has benefited us. But the DMP tool has an API, and data could be passed from it to other tools and workflows on campus. And this could be useful in reducing researcher burden and improving workflows. Next slide, please. So during the MAP pilot, we met with our university partners and we conducted interviews with research services personnel, and we identified some of the stakeholders, the tools, and the documents that are part of our research services landscape. And then identify which of these could benefit from the structure and content of machine actionable DMSPs. So from this, we tried to identify stakeholders that, one, had an interest in pursuing collaboration with us, and two, were able to contribute some effort toward this. And really, if we want to make improvements to this landscape, we're talking about how to make it possible to get certain data where it needs to go in an efficient way without duplicating any workflows or processes. And in talking with some of our partners, we decided to focus on creating well-defined proof of concept projects that demonstrate how our research services could be improved in a specific workflow if we made a change. So similar to what Kat was discussing, our IRB requires a data security plan from IT for each funded project that involves someone from appointed to Feinberg or anyone who is using Northwestern Memorial Hospital data. This DMSP includes data classification, data platforms to be used, where the data is going to be stored, very similar to what Kat was discussing. So what if we were able to connect these documents through PIDs, or be able to notify IT or IRB when a DMSP is created to help them plan? So as Kat was referring to, not waiting until the funding happens and then everybody rushing to complete these documents and figure out what is needed, but helping them plan and allocate resources earlier on. Next slide, please. So currently, we're working with our partners like the Office for Research, and IT to show how changes like this that I mentioned will benefit the services and to demonstrate a workflow. And we're also doing demonstrations on how DMSP data can be extracted using the DMP tool API. So we have some API scripts in a GitHub repo shared with devs and our partner units. We're discussing possible integrations with their tools, and also considering creating a DMSP template that would include the information that IT requires, so that researchers could put that in beforehand, and this could be notified. And we continue to encourage just simple acts like researchers who use the DMP tool to add links to their DMSPs into their research outputs when they use repositories using the DMP ID via a related identifier field or something similar when possible. Next slide, please. So I just want to say thanks to our project team and all the research services partners that participated in our site visit and interviews. Special thanks to Sarah Gonzalez, who did a lot of this work on the pilot and the site visit, as well as Tony Mackley, who has done a lot to help centralize these resources, and to help us set up communication between a lot of our partners. Well, thanks.